We do know more. We know that the evidence basis for efficacy for THC is worse than we thought. We know that the safety profile for THC is worse than we thought, particularly in terms of cardiovascular mortality and other safety issues, more drug driving fatalities. 96% of all drug driving incidences involve marijuana, 96%, which is fascinating given that clinicians are afraid to prescribe opioids in their patients who are driving or telling them not to drive when people drive under opioids considerably better than they do under marijuana. The neuromysticism remains severe, and I spent a lot of the past year on Twitter, and I post studies of the safety profile, which is not encouraging for THC and whole plant marijuana, and I'd get death threats, told that I was an idiot, cursed out wildly on Twitter, told that I was stupid, that I was misinterpreting the data. I find that very interesting as a major editor or major journal editor-in-chief. I guess I probably don't have the skills of data interpretation that these people who are not trained to interpret data have. But you know, they just hate hearing anything that is inconsistent with their belief system. You know, medical marijuana is probably about 1 part science at this part and 9 parts religion. And we want to see that balance shift towards science. And only then are physicians' practices, prescribers' practices, authorizers' practices going to be able to shift toward evidence basis. Yes, certainly one researcher who will go nameless, who refused to report any adverse events in his studies, has stopped doing research in the area. That's really encouraging. And what has come out have been many studies, including one that my group and I published in Pain Medicine, demonstrating just how opioids and THC don't mix. And I just presented a number of different studies showing that there's not that synergy that the neuromysticists would like us to believe, and that actually, believe it or not, marijuana, whether medical or recreational, may indeed be a gateway drug for many, based upon genetic predisposition, to opioid abuse. I don't believe it is safe based on physical risk factors, cognitive risk factors, and psychiatric risk factors. I don't see it as safe. Now again, cannabidiol continues to be seen as perfectly safe, and we're starting to see more cannabidiol research. And now that cannabidiol is available from the hemp plant, which is finally now legal, we're getting pure cannabidiol, and we're seeing some lovely results in pain and other fields. We also have the first pure cannabidiol medicine FDA approved recently in Epidiolex, but only for certain pediatric seizure conditions. For cannabidiol, that research has not yet been done, other than we know that for certain pain conditions there's a synergy with morphine. However, I spent many years in my practice taking people off opioids who never should have been on opioids to begin with. And I'm an opioid moderatorist. I'm not one of these zealots. And used a combination of buprenorphine and cannabidiol for rapid tapering, relatively rapid, 2 to 3 weeks, but physician guided, and patients all said, "Can I keep on using the cannabidiol?" Go at it. I mean, you get it at the nutrition store, you can get it online, you'll soon be able to get it at Walmart, and it's benign. So it's very exciting. The other exciting thing is cannabidiol manufacturers are producing pure cannabidiol. And that's a good thing too, because the mislabeling has been rampant and needs more regulation. All of this needs more regulation in my opinion, but that's just my opinion. Primary care should avail itself of more education, particularly regarding the safety issues of whole plant marijuana and THC, and the growing body of literature on potential efficacy of cannabidiol, the much more benign constituent, and understand that if it is below 0.3% THC, their licenses to prescribe are not going to be in any trouble. Cases where physicians have authorized medical marijuana and have simultaneously prescribed opioids were actual cases that brought up. I think we've only had a couple of them in this country. But now, if they're looking at cannabidiol, it's legal, it's unscheduled, and that's really exciting.